Hello, Dr. Amanatullah. How are you doing?
I'm doing great, thank you.
All right, let's talk today about some of the myths that surround weather and joint pain, joint replacements, all of those things, because there's a lot of them circulating around on the internet. So let's get to dispelling some of them. So, the
Absolutely.
number one that people usually come with is arthritis. So, in your experience, in your research, does weather affect arthritis at all?
Yes, this is a very common complaint that patients complain when it gets warmer or colder, that they can feel more pain in their joint. This has some really easy explanations, and it's not related to the arthritis itself. It's really related, and it's not necessarily related to the weather per se. What it's related is to high pressure and low pressure fronts. So your knee or your hip is basically a barometer. It basically has fluid in it. And that fluid in a knee is swollen. So it's under some tension. So if patients have fluid in their knee, we as doctors call that an effusion. And the pressures are changing around that. Patients can perceive that as more or less swelling in their knee, and that can give them pain. But the arthritis itself is actually not changing. It's just how much pressure that fluid has and really how much pressure that knee or hip had in it to start. So you could also imagine an arthritic knee or hip that doesn't have very much fluid. That patient might say, yeah, I don't really notice the difference in weather. But another patient who has a ton of fluid in their knee, on and off swelling constantly, and they'll be more susceptible. So for me, I think this is largely related to pressure changes in the environment and how much fluid or pressure the patient has in their knee to start.
Excellent. Now, as far as actually having a joint replacement done, is there one season that's better than another for having the surgery performed?
So the short answer is no. So a lot of patients do surgery in a seasonal fashion for insurance reasons, and I think that's largely driven by or holiday-based reasons why people do surgery more often in the winter. But there's no downside to doing surgery in any particular season. I think it really relates to the activities that you'll be able to do after the surgery. So that may also contribute to why patients may not want their surgery done in the winter, is it can be in some of the activities we'd like you to do, walking, particularly, or swimming, can be inaccessible in that season. So I think it's less related to which is better than the other, but more related to which is best for that particular patient.
Now, you mentioned about walking or swimming or whatnot in the summer. If I've had a joint replacement, do I need to take any special precautions for the summertime since I'll be spending more time on my feet doing physical activities?
So in general, no, but there are some precautions you can take that you might want to do in the early part of your surgery. So, scar forms over the course of a year to 2 years. And as soon as your incision is healed around 6 weeks' time, 4 to 6 weeks' time, you can begin to really protect it from the sun. That can be very important. Additionally, as we talk about water, you don't really want to immerse your wound in water in any way. So swimming would be one particular thing. Jacuzzi or anything else would be, or ocean would be another way. Until the wound is completely healed with no scab, just a scar on the top. So I think those are the two places where people kind of get themselves into trouble at the extremes. The other one is snow. So snow is associated with a lot of falling because it can be slippery, especially on ice or snow. So we really want to make sure that patients are taking really good caution with their gait aids if they're in a winter environment. So I would say, care for falling in the snow. As far as exertion for any of these patients, I think we can let them exert themselves as they see fit. I mean, that's kind of why we did the joint replacement. We want to protect our wounds from the water and from the sun.
What is the single most common myth that patients come to you with that you wind up having to dispel?
Oh, I think it related to weather specifically.
Hmm.
The other ones would be that your joint's going to function better in a particular season. I think that that's pretty much related to activity level. So, really, again, most of the function of the joint replacement itself is secondary to the muscles. So, if you're more active in the winter, you're going to notice it functioning better in the winter. If you're more active in the summer, then you'll notice it in the summer. So, it's really going to perform based on what you demand of it. The bigger one that comes up is related to kind of running, and it's normally a summer based thing, or extreme sports. So I think whether that be surfing or downhill skiing or um, any other activity that would be of higher demand. For me, I think it's really hard to tell patients that are feeling that well to not do those things. In general, they'll either not listen to me or they're asking me because they want my approval to do it. I think that's fine, but they have to understand that it could compromise the longevity of their joint. So I think that while it's not a myth or something I can dispel, I think we really have to counsel patients on how their activity level during the seasons can affect the survival of their joint replacement. So the more you use it, the more cycles get put on it, the more it could wear out. And we want to make sure they weigh the amazing benefits and happiness they get from the things that they do versus the limits of the engineering of a joint replacement.
So if they go on to do some of those extreme sports, are they looking at a sooner revision time?
So it's hard to say. I mean, what I can tell you is that if we can compare patients' age, if I compare patients under the age of 55 to patients over the age of 55, so let's just assume for a second the only difference between those patients is their activity level. It's true that patients under 55 fail earlier and faster. So, yes, the short answer is the more you use your joint replacement, the faster it will fail. But I mean, if I have a 65-year-old who wants to go back to playing tennis, again, you have to really weigh how many more cycles is that really? Is that person really placing their joint replacement at so much risk that it's not worth the joy of doing the activity? So for me, it's a constant struggle and balance between how much joy and exercise and hanging out with my family and my friends am I going to get from that activity versus the number of cycles that I'm going to put on a well done joint replacement. If it's the joint replacement is not well done, then we have a different discussion. You probably also won't enjoy those activities because they might hurt. But you can get back to those activities, just need to understand what you might pay for the benefits you might get.
Gotcha. Well, thank you so much for explaining that for us. Really appreciate it.
You're welcome.